Greeting Tufts University School of Dental Medicine colleagues. Today I would like to give you my Dean's update in the form of a recording of a PowerPoint presentation for the week ending August 7th. So today we'll go over some of the information that President Monroe shared with us last week in his town hall. I'll talk to you a little bit about where we are with our phase 2 planning. And then I'll talk to you about our testing protocols that will be in place for our community towards the end of this month. So some of you might have listened in on President Monroe's town hall meeting last week, but for those of you who couldn't attend, I thought I would just give you some of the highlights of his presentation. He talked about some of the key leadership transitions that are happening over the summer. We have a new VP of Human Resources, a new VP of Development. Marty Ray joins the President's office as the Chief of Staff. We have a new Dean of Student Affairs for the Arts and Sciences and Engineering area. We're very pleased to welcome Dr. Michael Jordan as the Director of the University Infection Control Group. And finally, we have Rebecca Ping, who's joining us as the Director of Emergency Management. And I believe some of you already got emails from her concerning the storm and tornado threats from last week. The President outlined some of the financial implications of the COVID-19 pandemic and some of the decisions that were made. He presented that all major revenue sources have been affected. He talked about the increased expenses that the university and each school is accruing, including IT, financial aid, PPE, cleaning and testing costs. And he outlined that the university is working closely with each school and division on mitigating actions and our budget development for FY21. As I've said to you in the past, the dental school is in a unique position in terms of our financial losses this year due to the curtailing of our clinical operations and due to the resumption in a very slow, logical way to ensure the health and safety of all. For FY21, he outlined some of the financial challenges. In particular, highlighted in red for you are the COVID-19 expenses and other impacts of about $27 million. And many of you will recognize that these expenses are not only happening at the university level, but in particular at the dental school. When you come into the building, you realize and recognizes the changes that we're having to make to our practice environments to ensure your health and safety. President Monroe stressed the fact that all of us here are invested in the health and safety of our community. We've done environmental changes. So for example, at the dental school, changes to our HVAC system. There are new protocols when you enter each building. And many of you that have been in the building recognizes the changes that we've made, including temperature screenings, the new apps that we have to fill out, etc. There are layers of protection for those that, for example, are patient-facing versus those perhaps that are in administrative offices. And then finally, the university is investing in a testing strategy for those in our community, and I'll talk a little bit about that at the end of my presentation. He shared with us this slide, and I think this is critical for us to understand, that as we enter our new normal, as we enter our building, it is our responsibility as members of the Tufts University School of Dental Medicine community to take care of ourselves and to take care of others. What that means is we have to adhere to good practices, not only for the benefit of our health, but for the benefit of our colleagues that are in the building and those that they interact with when they go home. So in particular, I would like you to focus in on the two bottom categories that President Monroe shared with us. That if you have a COVID-19 carrier with a mask and you're not socially distanced, and you as a healthy person with a mask are wearing your mask, there's an extremely low risk of transmission. For those that are wearing masks that are carriers and those that are wearing masks that are non-carriers, if you maintain the 6-foot social distancing, there's non-exposure. So the bottom line is, as we walk around the building and see each other, wearing of masks and social distancing and hand washing are critical to ensure that we don't have any kind of an outbreak in our facility. So I encourage you to continue to follow these protocols as faculty, as staff, as students and residents. It's incumbent on us to take care of each other as we continue through the fall and a potential surge. President Monaco shared with us the plans that they're making up on the Medford campus for an in-residence experience, not only including testing protocols, but here he showed us a picture of the modular units that are being set up on the tennis courts up there so that students that are identified as being positive can self-isolate in these areas. President Monaco also committed what the university is doing in terms of creating an anti-racist university. And you can see the work streams that were announced July 8th. Those having to do with an institutional audit and targeted action, those having to do with public safety and campus police, those having to do with public art, those having to do with compositional diversity, and finally a group looking at equity and inclusion. And we as a dental school are also committed to these work streams. This coming week, you are welcome as faculty and staff to sign up for a national anti-racism teach-in. I believe you received emails from our faculty development group here, as well as the university, to register for this event, which is taking place at no cost to Tufts University community on August 10th, 11th, and the 12th. Next, I want to share with you where we are with our phase 2 planning. Many of you have seen this pictorial before, where we said we would enter phase 2 after our first quarter, which is either towards the end of August or beginning of September. And as you'll see from some of our latest slides, we've actually entered phase 2 at a faster rate. Many residents, students, and faculty are asking why they can't see more patients. It's because we've taken a stepwise, logical approach to everything that we're doing. We want to ensure the health and safety. We want to prevent any kind of outbreak which would result in us having to go back to a safer phase and shut down our operation. And so while I recognize that you're all coming in and asking the question about wanting to see more patients, please remember that we continue to titrate ourselves against what has been so far a very healthy and safe return to work. As each phase opens up, as we can show our track record is good, we will increase for each of you your access to our clinical facilities and our patients. Again, a reminder that we're in phase 2. We have limited testing. We continue to do CDC screenings. We maintain social distancing, and we're striving towards open 50% of our floors in phase 2. Eventually, as you'll see, testing will become more apparent, not only for you as members of our community, but potentially for our patients. And at that point, we could have 75% of our floors open. Now, I will remind you that a lot of this is dictated by the city of Boston and the kind of numbers of people that they're allowing in buildings. And if there is a spike or a surge in the fall, we may have to go back a step. So everything that we present to you is aspirational, it's hopeful, we continue to move forward. But remember that the virus has no boundaries, and at any point, given the outbreaks that we're seeing across the country, we may have to move back a phase. Next, we recognize that PPE continues to be a challenge nationwide. Our procurement team has done a great job in terms of getting us PPE. And to that end, our PPE stock is good. Here you can see from the week of July 24th to July 31st, how we've gone from 41,000 masks of the Macrite type up to 49,000. And for our Moldex, we went up from 5,000 up to 18,700. So a special thanks to Beth Conant, Beth Estelle, who have been procuring many of these materials, and our team at administration. We recognize we've had to change masks, and the mask fitting, although it is a pain, so to speak, to have to go through that again, it's just part of what we're going through and many hospitals are going through. So thanks to all that have also been involved in our mask fitting. You received emails this week from Paula Callahan reminding you of the repurposing and reuse of masks so that we can sustain our supplies. You also recognize that we're now developing more sophisticated tiering of our PPE. And I want to thank Dr. Papa George and our clinical affairs team under Dean's Hanlon, Dr. Amato and Dr. Ghaffari for continuously looking at this and improving it so that we can continue to move forward with our clinical enterprise. You can see many of the physical changes that are happening in our building. These are pictures taken from our floor where periopros are. Many of the plexiglass barriers have been set up to mitigate aerosol spread. Many of you are using these extraoral suction units while you're doing aerosol generating procedures. And here on one of our DMD floors, you can see the work that's being done to increase the number of aerosol generating procedures that can be done on these floors. Other building updates have to do with our HVAC systems that have been updated. You can also appreciate the 5th elevator, which should be in working order, we're hoping by September 9th. And that will certainly increase the volume of patients that we can bring up to the upper floors. Dr. Amato has been instrumental in developing our schedules and working with our graduate programs. And Drs. Ramesh Zandona and Dr. Ghaffari continue to work with the DMD schedules. But you can see next week, which is the week of August 9th, we have our graduate programs back up on the 12th floor. Endo and ortho are now working on the 11th floor. You'll notice that these programs are no longer in the clinics on Sundays. And pediatric dentistry will be starting up on Thursday, Friday, and Saturday of next week. Oral medicine, craniofacial pain, and sleep programs are back on their floor. And our oral surgery program, unfortunately, is not back up on their floor due to the HVAC upgrades that we're doing. Our DMDs are active on the 4th floor. Many DMDs are asking why they can't go back to the 3rd floor, but we're currently upgrading our HVAC systems there and putting in our plexiglass partitions. So please be patient, and we hope that by September, you as our DMD students will be back on the 3rd floor. And on our 2nd floor, we continue to operate with emergencies and GPR and oral surgery. Aspirationally, in September, we would like to be at this stage where our DMDs are back on the 3rd floor, and then eventually they'll be back on the 2nd floor as we get into the fall. As of this week, we're averaging about 130 to 140 patients per day at the dental school. So again, thanks to all the staff, faculty, students, and residents for the work that they're doing at every level to screen our patients, bring them in, distribute scrubs, work on sterilization, etc. It's been great to see the progress that you're all making. I'm going to talk to you a little bit about testing now, both for our community and patients. The university has contracted with the Broad Institute at MIT to basically begin testing in early August. There are 106 schools across the state and country that are signed up with the Broad Institute. The Broad Institute can do up to 32,000 tests a day. And because of the volume of testing, each test costs about $25. And there is a 24-hour turnaround time. Many of you might have seen the textbook center where there is a testing center that's been set up. There is piloting that's going on to make sure that the system is working. And the first students that are being tested on the Tufts Medical site are our medical students to make sure that things are working. We are hoping that by the 3rd or 4th week of August, that our community here at the dental school will be starting to use this facility for testing. This is the setup. Basically, when you come into the center, you'll put your ID in one of these machines or swipe your ID, you'll get a custom identified sticky with a barcode on it. It'll be put on a test tube. There'll be a nasal swab that is taken, and basically the sample will be sent off to MIT, and you'll get your test results within 24 hours. The system is said to be very efficient, so we expect that despite having 1,000 or so members of our community that would have to be tested, that this will be done in a most time-efficient way. It is obviously complicated in terms of getting our rotations for testing set up, and that's why in the next week or two, we'll be working on those rotations. Here's a picture taken of the bookstore with the testing center set up. Not only are students, faculty, staff, and residents from the Tufts Boston Health campus being tested, but Emerson College colleagues will also be tested at this site. Now, there will be questions undoubtedly about what happens when people test positive. Right now, the state level, 2% of people in the state are testing positive. This could go up to as high as 5%. And if that happens, we need to know that that is going to be a natural course of this pandemic. We need to know what to do if we test positive, or if someone in our immediate vicinity tests positive as well. Dr. Rosenberg has been instrumental in developing our protocols and continues to manage the situation well if someone does test positive. So if you test positive for COVID-19, please follow the protocol of either emailing Dr. Rosenberg. If you're a student and or resident, you can certainly email Dean Kasberg, or please email the covid19@tufts.edu email. There is no need for you to alert people that you came in touch with if you identify as positive. You have to respect your confidentiality, and you have to respect that there are people that once they're alerted of someone being positive, will do the contact tracing for you. And they'll put the contact tracing into the right kind of a context. In other words, if you were only in touch with someone for a minute and both of you were wearing full PPE, your risk is very different from being in touch with someone without a mask on, etc. So as a supervisor and faculty who hears about someone who is being positive in our community, please don't take it upon yourself to identify the exposure risks. Tell people again to contact Rosenberg, Kasberg, or email COVID-19. You as a faculty member or supervisor have to recognize that the individual's confidentiality and health information is also confidential. So please remember to follow this protocol, because I have no doubt that many in our community will be exposed and will report as being positive as we ramp up our testing protocols. The other area that you can go to is the FAQ area at the Tufts University website. Has some very good information for you. Here's an example. What should I do if I was a close contact of a potential or COVID positive individual, etc. So I would encourage you again to visit the website. And if you have any questions at all, please do contact us and we'll let you know what to do. So with that, I'm done with my presentation. It's been great to see many of you in the building recently, and I hope to see many more of you in the building as we resume our services. Thank you all for all of your efforts and all that you do for the university, our patients, our students, faculty, and staff.